to a segment of approach to IMED questions. Today's task, we are still reminding each other that we need to demonstrate concepts on how to answer exam questions rationally. That simply means to be in order, smart, precisely. Then apply classroom knowledge, okay, in answering examination questions. Okay, then we have to apply examination etiquettes. We would want all our candidates, okay, our participants, to be precisely when they are answering exam questions. Okay, to provide enough cognitive power, that's knowledge in answering questions. Also, behavior should be professional at all times when you are attending to these medical examinations. So these are the key things that you will be still reminding each other. Today's session is hematology. Okay, so we're looking at Unit 4 and we have the scenario that we've been given. And this scenario is reading as you were in an outpatient department attending to patients at a hospital where you are doing clinical clerkships as a clinical officer. A female adult came to see you and was complaining of increasing weakness, palpitation, swelling of legs, pin and needle sensation in her fingers. You did laboratory investigations because of weakness, pin, and needle sensation. The following were the results. White blood count 6, red blood cell 2.4, hemoglobin 10.2 grams per deciliter, platelet 300, MCV 115 femtoliters, serum vitamin B12 levels are low, intrinsic factor is positive. What is the definitive diagnosis? 2 marks. What is the role of intrinsic factor in vitamin B12 metabolism? 3 marks. What are the 3 morphological classifications of anemia? 3 marks. Write 2 cardiac and 2 neurological complications of the diagnosis above, 4 marks. You discovered that there was a history of hemorrhagic disease in the history of the patient. 1. List 3 differential diagnoses of bleeding disorders, 3 marks. 2. Write 1 complication of hemorrhagic disease, 1 mark. Okay, so how do we start solving this question? So number 1, we have to identify the key areas, okay, and these key areas are now what we are looking at, the complaints. So the complaints is increasing palpitation and increasing weakness, palpitation, swelling of the legs, needle sensation in the fingers. Okay, and now let's try to now discover the problems. So the white blood cells, they are okay, but the red blood cells, they are low, and then HB also is low. Platelets are okay, the MCV is high, and then the other problem that we have there is the vitamin B12 is low, then the intrinsic factor is positive. So this is what we're going to concentrate at. Okay, so we have seen that we have the HB there having a problem. Then actually let me use the ready to just indicate problem. Okay, so we have HB there showing us anemia. What other abnormality have we discovered there? MCV showing us macrocytic. And then we have B12 there showing us hypovitaminosis. And then we also have there IF, which is low. Okay, so this is what we have gathered. So the entire picture, what does this picture show us? Okay, this picture shows us macrocytic anemia, secondary to vitamin B12 deficiency. Okay, so that's the picture that we have gotten. This is macrocytic anemia secondary to vitamin B12 deficiency. Now, the question is saying the definitive diagnosis. So what is the definitive diagnosis? So when you look at the definitive diagnosis, there is, we know that macrocytic anemia, okay, macrocytic anemia can come as a result of vitamin B12 deficiency, it can come as a result of folate deficiency, it can come as a result of liver disease, it can come as a result of alcohol, it can come as a result of hypothyroidism, it can come as a result of drugs like casdoftin, cotrimoxazole, phenytoin, methotrexate. These can all cause macrocytic anemia. Now, the most key that we have been given there is that, particularly, we've got evidence that among the different diagnoses we have vitamin B12 deficiency. Okay, and it is low there. Then secondly, we've been provided with intrinsic factor. This intrinsic factor is produced by the parietal cells in the gastric mucosa. And the role it is that it enhances or increases absorption of vitamin B12. Now, the question is, what causes vitamin B12? What's the most common cause of vitamin B12 deficiency? Or what's the cause of intrinsic factor to be low? Okay, that is an autoimmune disorder of parietal diseases. So meaning that whenever we see intrinsic factor, think about pernicious anemia. Okay, so pernicious anemia is the most common cause of vitamin B12 deficiency, which causes the what? The disorder, the defective of intrinsic factor production, because it attacks the what? The parietal cells. So the definitive diagnosis here is pernicious anemia. Okay, in there we get 2 marks. So from the broad, if you write macrocytic anemia secondary to vitamin, you can just be given 1 mark. Because now you need to explain what is the most common thing that we need here. What we wanted was pernicious anemia. That was the reason why we are given intrinsic factor to be positive. Okay. B. What is the role of intrinsic factor in vitamin B12 metabolism? The role of intrinsic factor in the metabolism of vitamin B12 is just to increase absorption. And you get 3 marks. C. What are the 3 morphological classifications of anemia? Whenever we hear about morphological classifications, it means that we are talking about MCV. MCV based, mean cell volume. So when the mean cell volume is high, then that is macrocytic. When the MCV is normal, that is normocytic. And when the MCV is low, that is microcytic. Okay, so this is what we are able to look at. See, so in this situation, we have an example there, macrocytic, which is there when it is high. So meaning that above 100, that is the macrocytic. Less than 80, that is microcytic. 80 to 100 femtoliters, that is normocytic. So now how do we talk about anemia? Because there's a difference of just saying macrocytic, microcytic, normocytic. We are just talking about the morphological of the cells. But when they say anemia, based on the morphology, then you have two parameters to use. Okay? The parameter number one first is HB. So low HB plus high MCV equals macrocytic anemia. The cell has increased in size, but the binding capacity or the hemoglobin concentration is low. Then that is macrocytic anemia. Okay, so let's try to go on our new page so that we can look at these classifications. So in short classifications on C, we have number one, HB, we know that's already low, plus C, MCV, that is normal MCV, then that is called the normocytic anemia. So in the exam, we are interested of just writing normocytic anemia. For me, I'm just trying to provide the concept. Number two, it is low HB plus low MCV equals microcytic anemia. Okay, in the exam, just write microcytic anemia. But I'm just trying to give you the concept on how are you coming up with microcytic anemia. Then number three is low HB plus high MCV, which is macrocytic anemia. Okay. Then we come to D. D is saying write two cardiac and two neurological complications in the diagnosis above. So number one, we'll start with cardiac complications. What are these cardiac complications that we should remember? Number one, congestive cardiac failure. We may have cardiomyopathy. We may have ischemic heart disease. So there we can either write myocardial infarction, we can write angina. Okay, so these myocardial infarction, angina, cardiomyopathy, okay, congestive cardiac failure. These are the complications that are common in cardiac. Number two, we look at the neurological complications. Okay, So the neurological complications, number one, what we have there is peripheral neuropathy. Peripheral neuropathy. Okay. Number two, what you have also there is depression. Okay. You have depression. Depression. Number two, you also have the peripheral nerve disorders like glove and stocking paresthesia. Glove and stocking paresthesia. Okay. You also have loss of ankle reflexes. You also have subacute combined degeneration of the cord. Degeneration of the cord. Okay. You also have killers to attack the cerebrum, like dementia. You also have optic atrophy. Then you also have what we call autonomic neuropathy. Autonomic neuropathy. Okay, so these are the complications based on the system. So from the cardiac aspect, you can pick any two from what I've given you. Just pick any two there. Then for under CNS, pick any two. Okay. So this is how we approach to the question.